What is the best fiber supplement to take with Tirzepatide? If you're taking Tirzepatide, you might be dealing with some digestive side effects. Let's talk about how fiber supplements can help and which ones work best with your medication. Tirzepatide slows down how quickly your stomach empties. That's part of how it works, but it also means digestive issues are pretty common. Constipation happens in about 10 to 24% of people taking it. Nausea affects 17 to 31%. And diarrhea shows up in 12 to 23% of users depending on your dose and which formulation you're taking. This is where fiber becomes really important. It helps keep things moving through your digestive system and can reduce your risk of constipation. The general recommendation is about 25 to 38 grams of fiber daily, but here's the catch. When Tirzepatide reduces your appetite, eating enough fiber through food alone can be tough. That's why many people turn to fiber supplements. Not all fiber supplements are created equal. There are two main types, soluble and insoluble. Soluble fiber dissolves in water and forms a gel-like substance. Insoluble fiber doesn't dissolve and adds bulk to your stool. Both are helpful, but they work differently. For people on Tirzepatide, two supplements tend to work best. Methylcellulose, which you might know as Citrucel, and psyllium husk, often sold as Metamucil. Methylcellulose is a soluble fiber that doesn't ferment in your gut. That's a good thing because it means less gas and bloating. It still supports regular bowel movements without adding extra discomfort. Psyllium husk is also predominantly soluble fiber. Research suggests it has benefits beyond just digestive health. Studies in people with diabetes have shown it may support blood sugar control and cholesterol levels, which can align with what Tirzepatide is already doing. Now, if you decide to add a fiber supplement, there are some important things to know about taking it safely. First, timing matters if you take any oral medications. Fiber can interfere with how your body absorbs pills. Talk to your pharmacist or prescriber about how to separate fiber supplements from other oral medications. The good news is that Tirzepatide is injectable, so there's no direct interaction there. Second, hydration is critical. Take your fiber supplement with a full glass of water, as directed on the product label or by your clinician. Without enough water, fiber can actually make constipation worse instead of better. When starting a fiber supplement, follow the product label and your clinician's guidance on how to begin and adjust. This gives your digestive system time to adapt and reduces the chance of bloating or cramping. And this is important, always talk to your healthcare provider before starting any supplement. They know your full medical history and can give you personalized advice about what's right for you. Speaking of talking to your doctor, there are times when you need to reach out right away. If you have severe abdominal pain, that's a red flag. If you haven't been able to pass stool for 3 days or more, call your doctor. Watch for signs of dehydration like dizziness, dark urine, or extreme thirst. And be aware of symptoms that could indicate pancreatitis, like severe pain in your upper abdomen that radiates to your back. Fiber supplements aren't a cure-all for digestive side effects, but they can be a helpful tool. They work alongside the dietary changes and lifestyle habits you're already using to support your health on Tirzepatide. Remember, everyone's body responds differently to medication and supplements. What works great for someone else might not be the best fit for you. That's why working with your healthcare provider is so important. They can help you find the right approach for your specific situation. So here's your recap. Digestive side effects are common with Tirzepatide because of how it slows gastric emptying. Methylcellulose and psyllium husk are generally the best tolerated fiber supplements for people on this medication. And always drink plenty of water with your fiber and follow your pharmacist's or prescriber's guidance on timing with other medications. This is medical information, not personal medical advice. For guidance specific to your health, speak with your doctor or healthcare provider. Have you found a fiber supplement that works well for you on Tirzepatide? Drop a comment and let us know. And if you found this helpful, hit that like button and subscribe for more evidence-based health information from Fella Health.